How to diagnose heartworms in dogs. You've probably heard that your dog should be on a regular heartworm preventative. This is because dogs are natural hosts for heartworms, parasites that can cause significant health problems for your dog. Since heartworms live inside blood vessels in the heart, they can damage the circulatory system, heart, blood vessels, and lungs. Prevention and early treatment are important. Learn to recognize if your dog has heartworm, so the vet can begin treatment as soon as possible. 1. Recognizing symptoms of heartworm. Listen for a cough. At first, you might hear your dog softly cough and assume that he's just under the weather. But, if your dog has heartworm disease, the dry cough will linger. You may notice your dog mildly coughing for weeks. Coughing becomes more noticeable after exercise, so pay attention to your dog after you take him out. 2. Monitor your dog's energy level. You may realize something is wrong with your dog's behavior before you even suspect he may have heartworms. Your dog might seem excessively tired after moderate exercise, or he might lag behind you on a walk. This lack of energy is a symptom of heartworms. For example, if your usually energetic dog no longer wants to exercise, you should consider that he's unwell. Pay attention to your dog's appetite. You might notice that your dog's appetite changes. Specifically, he won't be as interested in food or treats and won't eat very much. This causes weight loss, another symptom of heartworm infection. As the infection progresses, you may also notice that while your dog is losing weight, his abdomen swells. This is because fluid fills the abdomen. 3. Watch for signs of advanced heartworm. If your dog has had heartworms for a while, the symptoms may get worse. These severe symptoms include fainting, collapsing, or even death. If your dog shows any advanced signs of heartworm infection, take him to the pet emergency room immediately. Some dogs might suddenly have trouble breathing at the same time they pass brown-colored urine. You may also notice your dog's gums are pale. These are all signs of Caval syndrome, an advanced condition of heartworm which is caused by a sudden breakdown of red blood cells. 4. Consider how far progressed the heartworm infection is in your dog. If your dog has heartworms, symptoms can vary. For example, he may show no signs or may have breathing difficulties. Group 1 – infection is confirmed but the dog has no symptoms or only an occasional cough. This group has the most optimistic outlook for treatment. Group 2 – the dog coughs regularly and doesn't like to exercise. Group 3 – the dog has severe breathing difficulties, fainting spells, and signs of right heart failure such as a swollen abdomen and swollen limbs.